Yes, he Donnybrook is made possible by the members of 9PBS.
Well, thanks for joining us for this edition of Donnybrook. Good to have you with us. And on Next Up, the second half of our program, we'll talk to Dr. Alex Garza, who heads up the St. Louis area Pandemic Task Force. So we're looking forward to posing our questions about vaccines and more with Dr. Garza when he joins us. Let's meet the panelists who are joining us for this edition, starting with the news director for the Big 550 KTRS and the co-host of the Jennifer and Wendy show, Wendy Wiese, along with Mr. Bill McClellan from the St. Louis Post-Dispatch. Also from KTRS and a guy who writes for rawstory.com and the Riverfront Times, another founder, Mr. Ray Hartmann. And we welcome Alvin, Reid from 590 AM, 97.1 FM, and the St. Louis American. And Ray, we're going to start with you on this program because you did interview Talby Roach, the president and CEO of Bi-State this week, and he told you why. Well, he kind of explained what was going on at Metrolink in the wake of a tragedy on Sunday when a security guard on the platform at Delmar and Skinker was shot and killed. And as it turns out, security guards on Metrolink are unarmed, which I think is totally unacceptable. What's your view on this?
Well, first of all, it's a horrible tragedy. He was actually a supervisor who was on there. And as far as your point on armed security guards, you're just empirically wrong as far as the law goes. I mean, if you have to change both Missouri law and the compact that Bi-State operates under in order to arm security guards. In fact, 2 years ago, I think it was this month, actually, they did a major study, one of the top firms in the world on light rail systems, and they made the very definite point that you're violating law and common sense by having, at the time, rent-a-cops basically running around with our drug dogs and stuff. The thing was, this happened on the steps up to the platform. It was a horrible tragedy. He had no chance. Whether he had a gun or not wouldn't have helped him at all. It's a horrible tragedy. And overall, the facts are, I happen to think that Talby Roach does a very good job, but I think more important, we have a huge problem with perception of people being concerned that it's unsafe. That's not borne out by statistics, but it's a horrible thing.
Well, I'll tell you what, Ray.
I think it's more than just perception, Ray. I mean, I think there have been enough incidents and tragedies, shootings on Metrolink, and I've heard enough anecdotal stories from people. I think we need a lot more security there. And as far as changing the laws, I think that's a matter of interpretation. But even if we have to change the laws or get Metrolink its own police. But we cannot have unarmed people trying to protect us. I'm sorry.
This was a Marine, a veteran of 2 tours in Afghanistan who lives through that to die on a Metrolink platform. And Ray, with all due respect, please believe me when I say this is not about pointing fingers. This is not about the vilification of anybody, let alone Talby Roach. But I think that if somebody told his wife that it wouldn't have made a difference if he had a firearm, I'm not sure that she would see it that way. Well, I've heard that a number of times, and it just doesn't ring true.
But it changes the perception, not perception. But Wendy, I agree with you. If the assailant knew I had a gun, he wouldn't be as quick to shoot me as fast. Most cities in America, regardless of any study, the people that are guarding the train have guns. Now, why St. Louis would be the one, I have no idea. But also, we don't make people pay. And from what I read originally, I don't know if this is borne out, okay, but apparently they had some type of meeting together because he was sleeping on the train. And if you have to pay a fare to get on the train, that eliminates people sleeping on the train, which would have eliminated this first altercation, which possibly would have eliminated this man being shot in cold blood. They need guns.
Ray, you have to admit, Ray, in the city of St. Louis, if an officer or a guard on a train platform is unarmed, in this city, he'll be the only guy on the platform who doesn't have an arm. Okay, it's ridiculous at this time in our history with the crime rates that we have to have a security officer who's unarmed. Are you kidding me?
Okay, first of all, let's keep this clear. One of the Metrolink has, according to, again, there's the research and the reality now, the big
research, one report.
Okay.
One report from one woman in New York City, where, by the way, they have firearms like they do in San Francisco and Boston.
Okay, can I finish? Metrolink, forget about the source. Metrolink has plenty of armed police officers on the platforms, which is what they're supposed to have. The issue is, should the security guards who are on the trains, who are supposed to be concerned about what Alvin's talking about, which is collecting fares and customer service, should those people be armed? And it's a little like arming school teachers. You don't have
no. You
can't have armed. You're not going to have shootouts on the train.
He was a Marine with 8 years of experience, including combat in Afghanistan.
Right. A teacher is in the classroom to teach, Ray.
I get it, but they're not.
The trains are there to guard. That's two different things.
Okay, the people on the trains, the uniformed folks on the trains are supposed to be providing customer service in a normal light rail system. The police who are armed on the platforms provide security. That's the way it's supposed to be.
Okay.
Now, the point is, you're acting like there's no armed guards there. There's plenty of armed police.
We're not
acting like that.
This is ridiculous.
Right. From my time in Washington, D.C., on the Metro, one of the biggest ones in the country, they had armed security that were part of the police, the Washington, D.C. police force. That's what St. Louis needs. I don't want to hear about what it is or whatever. I was saying, like, this is ridiculous. This is horrible.
We have police from the county, the city, St. Clair are all there, and they're armed, doing the job. The point is,
on the train.
What are you talking about? Have you not read the stories in the last 3 years?
Yes, I have. Have you read this? Have you looked at the statistics in the last 3 years? The fact is, we have any amount of crime is too much. We have an average amount of crime for a light rail system.
Oh my God! Did you hear what you just said?
There's 50,000 riders a day during the day, and there's usually, there's a crime probably every day, not a serious one, and it's not as unsafe as people are saying.
I'm not saying that. What I'm saying is, when something happens, the security guard needs to be armed. Just say we don't have a lot of crime.
The people you're talking about are the ticket collectors and the customer service.
Well, this guy wasn't a ticket collector, Ray. He wasn't customer service.
They are supposed to be unarmed security. That's what
they're supposed to do both. But they're not concierges, Ray. They are not concierge personnel. They are not.
By state,
they are not valets. It's called Metro is contracting with a security firm.
Correct, but they are by definition not supposed to be armed and not have.
By definition, no.
Yes.
By the stupid policy.
Change the definition.
Well, then you have to change state law and the interstate.
Well, let's change it.
All right, fine, but don't blame Bi-State.
And by the way, no, it's Bi-State's fault, because if Bi-State had gone down there 5 years ago and said, like, hey, state, we need to charge for everybody getting on here, and we need armed security guards, and we need to quit, acting like we don't have a problem. And that's the reason this happened, was because Bi-State refuses to accept the fact that it's a problem.
Ray, we appreciate the interview you did the other night with Talby Roach on the Big 550. Thank you very much. Let's move on to Wendy Wiese on our second topic, only because the time is limited and Dr. Garza is waiting for us. Rachelle Walton Gray, former member of the St. Louis County Council. She was defeated last August in her bid for re-election, but all is not lost, because after she supported the candidate, Lisa Clancy, that was the county executive's pick for St. Louis County Council leadership, Ms. Gray did receive a job in county government, $89,000 a year, Wendy, to increase the number of vaccinated people in North County during the worst pandemic in 100 years. So, do you think the $89,000 is warranted for Rachelle Walton Gray?
I do. And I know that doesn't make me a very popular person on this panel, but this is a horrific pandemic. People of color are definitely being impacted at an incredible rate. You have an easily understood reluctance because of history dating back, well, way beyond the Tuskegee Airmen Project to this week's admission or lawsuit being filed against a couple of players who recently played in the NFL, and concussion protocols and settlements and all of that stuff. So I think somebody like Rachelle Walton Gray, with her connections, I read the Post editorial, I understand that she lost and all of that, but she still has connections in North County, and this healthcare initiative is important. I don't think Sam Page wants to be the county executive of the Tuskegee equivalent in terms of the vaccine. So yes, it's cronyism, but cronyism has been going on forever in the county and the city. And I think she could be very effective in this regard, and it's important.
Here, Wendy. I agree, Wendy. I will say this, that I would have not hired her as a job like within county government, but like contractually through some type of entity or something like that, so that she would have this job for at least a year, maybe if you had to proceed after that. But 1 year, $90,000, I have no problem with. If there's some mechanism to say your job doesn't exist anymore a year from now, which I probably don't think it will, I'm fine with it. But I side with you, Wendy, that at least she's doing something to get paid for.
I have a huge problem with it. This is the guy that said pay for play is dead. And this is with no, and I don't disrespect Rachelle Walton Gray for taking it. I mean, I guess she's received it. She's lucky. I mean, as Tim Fitch pointed out on my show, she gets a great pension from it. It is so crass and so political that I haven't seen anybody that wants to defend it. To the point you have that the county needs a person for this job, by all means, create the position, advertise it, and take the best person for the job. There's no problem with that. If you make a great case for the existence of the position, you don't make a great case to take somebody who just did you a giant political favor. Giant. I mean, literally.
It's still in court. I understand.
No, but I'm saying you made a great case, Wendy, for having the position, but not a case at all for why you pay off somebody who just did you a huge favor. I remember when
she did say that. She has tremendous North County. Wendy did explain it. She says she has tremendous North County contacts.
I don't know that she does. She just lost an election.
Yeah, that doesn't matter, Ray. That doesn't matter. That doesn't matter. The federal government.
Everybody got upset with Hazel Irby. The difference when Hazel Irby got hired and people said, oh, she got paid off, is Hazel Irby had not done Sam Page any favor. In other words, Hazel Irby got hired because Sam wanted her off council.
And I believe she was making $40,000. Wasn't she making $40,000 more? Wasn't she also making $40,000 more?
No, she wasn't making $40,000 more. And plus, Hazel Irby was actually
making
doing
I thought she was making
She was making more money, of course. And that helps the pension.
But the point is, Hazel Irby didn't do a favor
all this outrage, Ray.
Your pension is configured by the last 3 years of your salary, right? So if you increase those last years, you have a better pension. And by the way, don't forget, Pat Dolan was defeated by Lisa Clancy on the St. Louis County Council, and then he got a job. I don't know. It sounds like you're native Chicago, Bill, with ward politics.
Oh, absolutely. And I thought this was crazy. I mean, if of course, Gray has a lot of contacts in North County, and her father was a big politician in North County. But there's other people with connections, and there are people with backgrounds in healthcare. I mean, the idea that you're going to give this to the defeated candidate who came in and in one last dying effort gave you a huge vote. I'm with Ray on this.
Well, Bill, while we have you here, I want to talk about your column this week, where extraordinary column where you interviewed 20-year-old Emily Hernandez of Sullivan, Missouri, who has been arrested on 5 charges, all misdemeanors, federal charges though, because she was a part of that rampage at Capitol Hill on January the 6th. In fact, she was photographed carrying a sign from Speaker Pelosi's office. Now, you interviewed her. She seemed like a little bit to me in the interview like she was just saying, hey, I was kind of like the piano player at the brothel. I didn't know what they were doing upstairs. Do you kind of figure that this woman really didn't know what she was getting into?
Well, to a degree, I mean, I quoted that woman from the Washington Post who wrote that a lot of these rioters, after they were caught, tried to act like they mistakenly got in line for Insurrection Mountain at the Magic Kingdom. And there's a degree of that. And I certainly was not expecting Emily Hernandez to be like she was. I mean, I was prepared to ask about where she got her news and, and try to figure out how a 20-year-old, now 21-year-old, could be radicalized in this way. And instead, she came off, I don't want to use I don't mean to be terribly derogatory, when she seemed like kind of a ditzy 21-year-old kid from a small town who's delivering pizzas, who got a chance to go to D.C. and took it. And part of it, me, that I believe her, is I want to believe there still are kids like that in small town America who might be living in Trumplandia. I mean, that's Sullivan, Missouri, but who really don't care. And like when I asked her, did you vote for Trump? She said, I didn't vote. I said, well, you didn't vote? And she said, well, I voted in 2018 for marijuana. And then her attorney, who I like a lot, said, that's medical marijuana. And she said, yes, it was. I like to think that there are people like Emily Hernandez still in small town America. I'm not sure if it's true.
It was such a great, I have to say, it was such a great column, first of all.
Thank you, Raymond.
For all of us to say that. But if you had written it, and I would have definitely said, no. I have to say, part of me still thinks that you made the point that it would make a great movie. And I can't decide whether she'd be an actress or not. In other words, I don't know, but I also don't really, I kind of came away. I loved the column and I thought, well, if you think she was, maybe, but I could also see a scenario under which is sort of things she should be saying if she wants to have some.
Well, and if I'm totally mistaken on her, it's not the first time I've been totally.
Now, my thing is that. Go ahead, Wendy. Go ahead.
No, this is where I think, and it was a fantastic column, and I know everybody is going to enjoy it, but this is where I think somehow we have literally gone hurtling off the railroad tracks, because if a 21-year-old protester in the aftermath of the death of George Floyd burns down a building, which in my mind, I would be screaming from the rooftops that they should be prosecuted. I don't care how young they are. I don't care how young she is. She should be prosecuted.
She is being prosecuted, Wendy.
I understand that. And I mean, she should serve jail time. And I mean, this is a serious crime, whether she is a ditzy 21-year-old, just like I was. You have to, there are actions and there are consequences, whether you are a member of Antifa, or whether you are a member of QAnon and you're raiding the Capitol. We seem to somehow, because these people are young, we make excuses for them.
I think she's lawyered up. I think if I was her in that situation, I would play the ditzy daughter of the American Revolution who got led astray by two sinister individuals of the same thing. I'm just not buying it. And with you, Wendy, full extent of the law. And I will say this, I have a 20-year-old daughter, and my oldest, Bryce, will be 22 on February 16th. I'd be trying to find them at Guantanamo right now, let alone them getting interviewed for the St. Louis Post-Dispatch.
While I've got, by the way, we'll check out the column in the Post-Dispatch, stltoday.com.
And it's really good. It's a really good column.
I want to ask you, Alvin, about the state of Missouri, which admits that it overpaid unemployment benefits by about $150 million. In fact, 3% of those received unemployment benefits this past year, kind of in the rush during the pandemic, were overpaid. And now the state wants to claw that money back. And some people received $8,000 in the unemployment benefits, federal and state, and spent the money. Now they're being asked to pay it back. Should they be required to, or should the state forgive it and say, hey, it was our error, don't worry about it?
Well, I would think that there was ways to do it. But yes, I think the state can claim some of the money back. Now, first of all, do a percentage like a loan or something where you don't have to pay this back because this was our bad. So even though you owe us $8,000, let's say you owe us $7,000. Now let's figure out a payment plan, or you forfeit your, if you get any kind of money back from the state on your state in tax fund or tax burden, then you forfeit that back to the state. But yeah, I think the state is okay to ask for the money back.
I'd like to see the people be able to keep it. I know that's easy to say, but talking to legislators who have constituents, these are uniformly people who need the money and a state that doesn't treat them very well. And they got it through no fault of their own. And I think the state can afford to, almost without exception, these are people who probably spent the money because they needed it and don't have it to pay back. I just think they should let it go.
And I'm with Ray. And wouldn't the money mostly go back to the feds anyway? I mean,
that's correct.
That might be true. I understand, but
like poor Missouri. And I think a lot of these people could make an argument. I mean, the stories I read in the paper, people who are like working part-time or this or that, the idea of all of a sudden you're going to hit these poor people with a $6,000, $8,000 bill, it's way too much.
Well,
I just let them keep it.
Try to work something out. I would say this. All right, I have look, Bank of America has got $1 trillion. But if I hit the 100 like cash withdrawal and it gave me $1,000, ultimately, in the back of my mind, I know like I'm gonna have to come up with $900 at some point. So, I think
that happened. Remember Diane White, the lady.
I was thinking her when.
What happened to Diane White?
Well,
what happened
to money in her account? It wasn't her fault. They put the money in her account, but she spent it, and she got in trouble with the law.
She got in big trouble. So I'm just saying, you kind of realize that ultimately, I think I might be responsible for this money. Now, I'm not saying all people who got this money, unemployment money, knew, but there were people that knew that this was wrong.
Well, about 3%
and I thought even some of
fraudulently.
these statistically were the ones, Charlie, who decided that they weren't going to look for work because they were getting these unemployment dollars. And not that makes a difference. If they would even repay a portion of it, I would be all right with it, because Ray is being very generous with everybody else's money. And all.
Let me say, whatever happens to bank air in your favor, and monopoly.
Yeah. Okay. Bill McClellan, I want to ask you about a case out of Forest Park this past weekend where a local emergency room doctor was jogging or walking with his dogs, and he came upon a woman who was being sexually attacked. And thankfully, this doctor did ward off the perpetrator, who was later arrested. But various parts of the story are interesting. One I'd like to look at is that when the doctor called 911, he was put on hold. And then your colleague Aaron Heffernan from today's Post-Dispatch points out that 30% of calls to 911 in the city of St. Louis last year went on hold. And in fact, 1 out of 6 callers, 16%, of those who called 911 just gave up and they hung up. What do you make of this?
Well, I thought Aaron's story was terrific, and I was shocked. And to read that the same people who are doing the non-emergency calls are also the dispatchers for 911. That boggled my mind too. I mean, this is just ineptness. I'm amazed at it. This same story, Aaron's story pointed out that in the county, 911 calls are answered within, I think it was 4.5 seconds. And I thought, there's really no, I mean, the county has more resources than the city, okay, but there's no reason that the city is putting people on hold and the county is getting it 4.5 seconds. I don't know who's in charge of that, but it's ridiculous.
You're right, Bill. Hats off to Erin Heffernan on the reporting, because her story about the woman who was jogging was harrowing to read. I mean, she really took the reader to that gravel path in Forest Park on that rainy, cold day. But I mean, Kara Spencer running for mayor has made it part of her campaign. This is the 911 emergency response. And from her vantage point in South City, and then I was thinking about this triple murder today. They've arrested the suspect, but how many people probably called when they heard those gunshots and had to wait as well? It's inexcusable, and we just cannot continue to claim that we want to be a world-class city when this kind of thing goes on.
I'll pile on and just say this, that, other places, and you have to determine what's really, really, really important. And that is one of those things. It's like, well, 911, be it the city, county, rural, or whatever, if somebody dials 911, there should be immediate police response. Then you deal with whether or not we're supposed to be there or not. But to have a situation like that or other situations it's just ridiculous. And like I say, Bill, you're talking about the county and you come off trying to sound aloof and whatnot. But seriously, I wouldn't have it any other way.
Right.
I mean, I just don't understand it.
I think it's beyond ridiculous. It's so unbelievably unacceptable. And the interesting thing is, I've heard Kara talk about this and others, and it shouldn't take this, but it hits you in a different way when you read about it in a story like this in the context of a specific crime, a specific person who's trying to help a poor woman who's being assaulted, and he gets put on hold. It somehow hits you different than the statistics do.
Well put, Ray. Okay, folks.
Like the Metrolink
Thank
story.
you so much. We are out of time for this segment, but don't go away, because in just a moment, we're going to talk to Dr. Alex Garza, who heads up the St. Louis Metropolitan Pandemic Task Force, and we'll be posing questions his way about vaccines and more. That's on Next Up. Don't touch that dial.
Donnybrook is made possible by the members of 9PBS.
Well, thank you for joining us for the second half. We call this Next Up, and it's when we talk to a community leader who's kind enough to join us and answer questions. And now Dr. Alex Garza joins us for the third time since March. This is a hat trick, Doctor. Dr. Garza is, of course, the head of the St. Louis Metropolitan Pandemic Task Force. And wow, first of all, thank you for your service these past 10, 11 months. We sure appreciate that. And welcome back to Next Up.
Well, thank you, Charlie. I hope it's not a Gordie Howe hat trick, though.
Well, let's start with the area you're quite familiar with, vaccines and the coronavirus. About a week or so ago, this panel was talking about how Missouri was ranked 50th out of 50 states, of course, when it came to getting the first shots in individuals as a percentage, rather, percentage of out of 100,000. This week, we're a little better. I think we're 49th. Illinois is not actually that much better either, but it does seem like other states are doing better getting the vaccine into the arms of their residents. Why, in your opinion, is Missouri lagging?
Yeah, that's a great question, Charlie. And I don't know if I have a great answer for you, but I can give you a couple of ideas. So first, let me tell you about some of the experiences in St. Louis. So we know that within the healthcare systems in St. Louis, we run through vaccine pretty much as soon as we get it. Now, I think early on there was a little bit of a ramp up period trying to get processes underway. But pretty much now, everybody is running through all of the vaccine that they have within the week that they get it. So that's one issue. The second thing is before last week, and you saw the governor came out with the plan on, I believe it was Monday of this week when he made his announcement about distributing vaccine. It was highly variable when you were going to receive vaccine as a healthcare system or as a public health department. And that causes a lot of chaos when it comes to scheduling. Because, of course, if you schedule people to get vaccine and then you don't get vaccine, then you're scrambling and you're trying to figure this out. And so I think there was some hesitancy to schedule people as well, because you didn't want to schedule people if you weren't sure if you were going to get vaccine. And then the other piece is if you look at the total of that data, and I just went to it right before I came on the show just so I could check it again. You are right, 49th for first dose per 100K. But we're doing very well with that second dose per 100K. And so it makes you wonder, like, what does this data really mean? Are some states using, so there's some concern about people using that second dose as a first dose to pump up their first dose numbers where their second dose numbers are really low. There could be some of that going on. If you look at the amount distributed, column, Missouri is one of the lower states in the amount that's distributed. So is there an allocation problem? Because obviously you can't vaccinate people if you don't have vaccine, and that number's never going to move if you don't have vaccine. So there's a lot of unknowns to really get, I think, a lot of context to those numbers. But be that as it may, it's never good being 49th or 50th. And so we do have to improve on that.
Doctor, I think it was today, or certainly recently, the CDC said that the Oxford AstraZeneca vaccine not only apparently shows great promise when it comes to guarding against the virus, but actually slowing the spread of the virus. Dr. Fauci said, if it's true, that would be important and wonderful. And I was just wondering, because we're hearing about the efficacy of this vaccine or that vaccine,
right?
And it kind of seems like even if one is 70% effective or 60% effective or 75% effective, it's still helping in terms of herd immunity, or at least bolstering our resistance. Is that, and obviously I'm not a doctor, but that's just the way it reads. Is that correct?
No, you're absolutely right. And so just to put this into a little bit of context, when we first started out, when I say we, it's the collective we, when the country first started out on this this grand plan to make vaccine early on in the pandemic, we were planning on around 50% efficacy. And the flu shot from year to year is anywhere from 30 to 50. So just to give you a little bit of a barometer. So when those first vaccines came in at 95%, that was like a game changer. Like that is usually never seen. And so that was incredible news. So I think we've conditioned ourselves a little bit to say, well, we've got to be at 95, but we don't. That 77% that J&J was coming out at, and this 60 to 70%, that's all still really good vaccine. And so we shouldn't be thumbing our noses at it or saying, no, I'm only going to go get the 95. That's not true. The thing that you're talking about is decreasing transmission. So that doesn't mean that the other vaccines cannot prevent transmission. It just means it wasn't studied to do that. It was studied to prevent severe illness and death. Now, it very well may end up being that it prevents transmission as well, just like the other, the AstraZeneca vaccine. It just hasn't been studied yet, and that's why.
Doctor, when the pandemic first began, it was easy to understand why everybody was confused and nobody knew what they were doing. But we've been expecting a vaccine from the very beginning. And it seems like, here it is kind of a year later and we finally get the vaccine and it still doesn't seem like we know what we're doing. I don't mean to be pointing fingers at you, but it doesn't seem like there's much coordination. People don't know whether they're going to get it from this hospital or the county health or that hospital, and different entities have different ideas of who should get it first, and it just doesn't seem. It seems like we were shocked and delighted when we got the vaccine, but weren't ready for it. Where am I wrong?
No, I don't think you're wrong, Bill. But what I would add though is that I don't think people understood the complexity, and so let me walk through a couple of things. So the amount of vaccine that is coming from it goes from federal government to state government, then down to the locals. The amount that has become available is very small. And so whenever you have a scarce resource, then it becomes much more complex in allocation, because now you're trying to decide who in the population gets this scarce resource. And so it's no different from any other scarce resource. We went through this in medicine years ago with dialysis machines, trying to understand who's worthy of getting dialysis. So that's one thing. The second thing, and I think this is a fair criticism, is that there was not a national sort of plan going through all of this. Now, there was this tiering process, but those tiers are very large. So if you look at where we are right now, we have that 1A, which we think we're getting close to, calling the end of that. We have that 1B1, which is your first responders, and we're working through that. But that 1B2, that is a huge population. That's over 65, 18 to 64 with a medical condition. So now you have millions of people, and you have a fraction of doses. And so now it's incumbent upon us to think about, now how can I, in this big bucket of people, now make sure with some equity as well, be able to vaccinate the most vulnerable. So think about people that are older, because we know older people get much more sick, and they have a higher rate of death than the other populations. People with certain diseases, and don't forget the equity question. So I think what was, in answer to your question, I think what wasn't all the way thought through was, what if we only have 15,000 doses for 2 million people? How are we going to segment that population even further? What should be the guidance that we're giving? And remember, each state has their own basically vaccination criteria. I mean, it follows a general pattern, but the governor gets to choose, like, these are the people that are eligible. But that makes it incredibly difficult then to say who deserves the vaccine the most, or maybe not who deserves, but who does it help the most with the local health departments and the local healthcare providers. And that's what we're struggling with right now, is to come up with what is that population. And it's frustrating. It's frustrating for us. It's frustrating for the public. It's frustrating for everybody. Bottom line is, we don't have enough vaccine. That is the bottom line.
Well, we all look for.
Oh, I'm sorry.
Oh, I'm sorry. It's your turn.
Okay. Who knows? Doctor, the lead story this afternoon at Bill's newspaper is that there are more than 300 pharmacies in Illinois have received vaccines as part of this new program. Mm-hmm. And that number exceeds Missouri by more than 300, meaning Missouri has zero. Mm-hmm. And that's great for our Illinois viewers, of course. And I know it's awkward because you have, as part of your job, you have to work with the State Department of Health and Senior Services. But what do you say? I mean, is there some good reason why it would be more than 300 in Illinois and zero in Missouri? And the stories in Missouri are that DHS wants back the vaccines that already have gone to the Walgreens. Can you help us make sense of that?
Yeah, so let me describe what those vaccines represent first. So the vaccine that Missouri wants to pull back from CVS and Walgreens is part of a federal program. So think of vaccine divided between a federal program, which was supposed to go to CVS and Walgreens for nursing homes and long-term care. And then there's the apportionment that goes to the state, and that's the part that you hear the most about. The allotment that went to CVS and Walgreens was for nursing homes and long-term care, There were some concerns that they were not vaccinating either fast enough, or there were some challenges with getting into the nursing homes, whatever. But they had a considerable amount of vaccine that was, remaining unused. And so from what I've read, and I know just as much as you do, is that the governor then decided to take that amount that was not being used in the federal program and pull it out and put it into the state program. So that's the one piece. The piece that you're talking about in Illinois is, again, another federal program that direct ships to pharmacies. But that's more for public use, not for that long-term care use. And that differs from state to state. So Illinois is doing it, Missouri is not, and that's really up to people above my pay grade on how they want to do that. Now, the bottom line, though, is whatever is the most efficient way for us to get shots in arms. And as I said at the top of the hour, we're moving through vaccine very quickly in the healthcare systems. Public health is as well, these mass vaccination sites. And so whether adding another outlet is going to improve that rate or not, I don't know. I think when more vaccine becomes available, definitely going to be moving into those pharmacy sites, because anytime you can increase availability, you're going to increase that rate. But with such a scarce amount that we have right now, it makes it difficult to sort of diffuse that across multiple different vaccination sites.
If there's any part of this where you don't know any more than I do, this is very concerning to me. I know how hard you've worked, but that's concerning that you would.
Yeah. Well, I know what I hear on phone calls. It's not too much different than what you hear on the press. But each state sort of has their own ideas on how they want to go about their vaccination process. And so the state of Illinois and I think it has to do with concentration of those drugstores as well. CVS is headquartered in Chicago, so they have great penetration in Illinois. Maybe not as much in Missouri. So I think all of that goes into the decision factor as well.
Well, Doctor, I'm sure you're aware of this, but obviously the vaccine is in short supply. But some of that vaccine over the weekend went to some younger people who would have been like maybe down toward the end of the list, but yet they were able to get the vaccine while others cannot. Can you explain what went on? Maybe other than people just purposely checking the wrong boxes, or once you get there and says like, you look 24 years old to me, I'm not giving you this shot. Mm-hmm. What could happen to stop that type of thing, especially since we're trying to work our way to mass inoculation sites?
Yeah. I really don't know exactly what went wrong with that. I read the same stories and heard the same concerns, and rightfully so, the concerns about people not being eligible getting vaccines. So let me explain a little bit, though, about some of the different processes for getting vaccination. And again, this isn't the cleanest. Back to Bill's question about confusion, I think this is also one of the confusing pieces. So the healthcare systems, we understand who our patient populations are because obviously we have their medical records. And so we can sort of self-identify patients that are older, patients with medical conditions that put them at high risk. And so we're able to identify them, then we can send them invitations to get scheduled and fill up our vaccination schedules. On the public health side, there is a little bit of a deficit because they're relying on people to be honest about, health conditions and age and things like that. And so when they sign up on these public websites, you put your age in and you put in if you have a chronic medical condition. Now, I also heard that one of the check boxes on the city site, the BMI, the body mass index, was different than what it was supposed to be. So that may have had something to do with that. So there's a couple of different reasons. One other thing that I heard today from one of our partners in the region is that there are younger people with chronic conditions. So think about people like with sickle cell or with cancer, things like that, where they are being berated for being in line for getting vaccine as well. And so it sort of cuts both ways. And so we don't want to set up sort of this, what one of my friends called, vaccine Hunger Games as well, where somebody who absolutely qualifies for vaccine, but they're younger, but they do have a disease, gets criticized for being in line as well. And so this is just one more complexity when it comes to trying to distribute a very scarce resource and protect the most vulnerable.
Well, Doctor, since the shortage of vaccines seems to be a major problem for Missouri and Illinois and the entire country, do you know if we should be invoking the Defense Production Act and kind of getting into wartime production measures, all hands on deck? Where's Rosie the Riveter, like we did in the 1940s when Germany was our enemy? I mean, at this point, should we kind of consider the coronavirus kind of like the enemy, and we should be taking the Anheuser-Busch factory on Pestalozzi Street and converting it into making some sort of medicine that'll vaccinate everybody in Missouri and Illinois?
Yeah, absolutely. Actually, we should have been doing that about 12 months ago, but we are where we are. And so, as I always like to use Donald Rumsfeld's quote: "You go to war with the army that you have, not the one that you want." And so, this is the one that we have. But absolutely, we should be, using the Defense Production Act to improve production. Now, from what I understand, the challenging piece is the manufacturing part. Because remember, this is a completely new vaccine, at least the Pfizer and the Moderna vaccine. It's a messenger RNA vaccine. Nobody's ever used this before, and so it's fairly sophisticated technology to make it. And so as easy as it sounds, like, hey, we could convert some factories to start doing this, I don't think it's as simple as that. But things that we can do is to help out with the production. So whether that's producing more glass vials or syringes or all of those other support things that go along with the vaccine, we can definitely use the Defense Production Act to do that. Now, if you think way back, when I say way back, it was like November of last year, not that long ago, we were told that production would pick up by January and that, millions of more doses would be coming out, but that turns out to not be true or not be as fast as we would like it to be. So playing a little bit of catch up here, and because of the sophistication of the vaccine, it's difficult to sort of ramp up that manufacturing capability. So we're in it. It's a difficult problem to try and solve.
Well, the sitting president was preoccupied, so what can we say?
I like Charlie's idea about was it the beer in the vaccine or the vaccine in the beer?
That's called the placebo effect.
Oh, okay.
I'll volunteer for that study.
There you go.
Wendy?
But the numbers of people, and I know that your colleagues across the medical community are stupefied by the numbers of people who refuse to get the vaccine. Your colleague, Dr. Michael Kinch at Washington University this week compared it to allowing the Japanese to bomb Pearl Harbor over and over and over again, that it's that detrimental to the nation. Yeah. Can you add your 2 cents in terms of encouraging people who refuse to get the vaccine to roll up their shirt sleeve?
Yeah, so that's a great question, Wendy. It's a tricky balance. So we know even in healthcare that there's some hesitancy to get vaccine, and it sort of plays along a couple of different planes. So one is sort of trying to squash the rumor mill. So there was, an internet rumor that this vaccine would make young females infertile. And so we had to come out with a messaging campaign for our own workers who were afraid to get the vaccine because of this, with our maternal fetal experts to talk to them and say, look, this isn't true. There's no evidence to support this, so that they would become more accepting of vaccine. The second sort of level is in, the level of education, or how much do you understand about, the science that goes into vaccinations. And so what we found is that, with our populations that are higher educated, so think of, those physicians and nurses and things like that, we're much more willing to accept vaccine than some of the other populations within healthcare. So think about things like housekeeping or janitorial staff. And that sort of bleeds, though, into some of the cultural issues with vaccination. So there's a couple of things there. So there's definitely an anti-vaxxer, community out there. They're very difficult to convert to taking vaccines. Doesn't matter if it's COVID vaccine or measles or anything, right? But there's also healthy skepticism amongst other populations, particularly in the African American population, where they have good reason to be suspicious of healthcare because of previous wrongs, whether that's the Tuskegee Airmen experiments or Henrietta Lacks and things like that. And so, as I've told people, Charlie, you referred to this as wartime, and you're absolutely right. In wartime, as many of you know, I'm in the military and I've deployed to war. Half of war is information and messaging. And so you have to make sure that you're getting the correct message out, but also who is delivering the message. So, Dr. Garza can stand up here, talk all day about vaccine and, about p-values and efficacy rates. But they also need to hear it from somebody that they trust, somebody that, looks like them, is able to see who they are in their neighborhoods and things like that. And so it has to be a really diffuse message. And that's how we convince people that this is a good thing to do. It's going to take some time. And I think people are a little bit hesitant, but once they see more people getting vaccine as well, and, their arms not falling off and they're, not growing 3 heads, then it becomes a little bit more acceptable as well. So I do think it'll pick up, but information is really half the battle.
Doctor, let's talk about timelines and when you think that this is going to be a more settled situation. For instance, think a hypothetical grandfather who's going to have his shot and his wife is going to have her shot, and they're thinking of taking 2 of their grandkids to Disney World in early June. Now, do you think that the world will be settled enough that that grandfather will be safe doing that?
I'm really hopeful that it will, Bill. And so let me explain sort of my rationale for thinking this. So if we're looking at our data right now for hospitalizations and admissions, and it's come down, rather precipitously since we hit that high water mark in like November, December, January timeframe. And we think that's been a contribution from a couple of things. So I think people are adhering to those mitigation strategies. So they didn't get together over the holidays, things like that. But I wouldn't discount the contribution from vaccinating people in long-term care, in nursing homes, and other places to bringing that number down. So why is that important? Because those are people that come to the hospital that more readily are admitted to the intensive care unit and consume a lot of healthcare resources. So if we can safely protect that population, a lot of the population has become an asymptomatic, carrier, and they've gotten better. We don't know what that total population is. We think it's probably maybe 15% of the population, still unsure. Nobody knows really. And then if we continue to do vaccinations through these different age groups and priority groups, I do think that we're going to get to that point probably by late spring, early summer, where it will look and feel more normal, where you will start seeing restaurants becoming much more open, having more people there, be more travel, things of that nature. So I am pretty hopeful that we can get to some degree of normalcy by that beginning of summer timeframe.
Thank you for that.
Doctor, I want to ask you kind of off of that question. It seems like every day we're hearing a different message or about the seriousness or the concern about the variants, mutations, whatever you want to call the new viruses that might compound the problem. What is your latest thinking? It seems like it changes. Maybe it's just me, but what is your feeling about how concerned we need to be about these variants and so forth?
2 minutes to go.
Yeah. So it's sort of a wild card out there. We don't know what the contribution is going to be. We do know that the vaccines at least have some efficacy against it. Maybe not as much as the normal variant, but at least some to protect the person. But the other thing is the protection strategies don't change. So as long as we keep up our protection strategies, meaning wearing masks, socially distanced, not gathering in groups, things like that, that still protects you against these other variants. So we cannot let up on any of that because the risk of becoming infected if you slip up is that much higher with these other variants.
Minute to go, Alvin.
Black people, get the vaccination. All right. No, my mom got it. She's perfectly fine. And it also, Dr. Garza, I would just, a piece of advice, the syphilis study at Tuskegee, there's a large part, of the African-American population doesn't even know what that is. I think a big problem is get across that you don't have to have health insurance. You don't have to have any money. Get on a list. So is that wise advice?
Great point, Alvin. Thank you.
All right, thank you.
I appreciate that. I appreciate your comments today, Dr. Garza. Thank you so much for joining us. We really appreciate the time you took to answer our questions. If people want more information, they want to find a vaccination site, is there like the best place to go? Is there one best place?
Well, I guess I'll always promote our St. Louis Metropolitan Pandemic Facebook page. We have all of the links to the different healthcare systems, phone numbers, to health departments, places like that, where people can go to and get that information.
Thank you so much.
You're welcome. Thanks, Charlie.
Donnybrook is made possible by the members of 9PBS.